So when I first started, I struggled with the appliances. That they technically were very foreign to me. Of course, I've read about John Mew's appliances, and Enrico, my technician, had created them previously for other dentists, and they seem straightforward enough, but fitting them, creating adequate retention, adjusting the wire work, that was really, really difficult and took enormous concentration and effort for often very little outcome. I'd book a half-hour appointment to do an insert, and I'd be an hour before I could anywhere near be in a place where I felt comfortable and had the patient in a good position to leave. The concept is simple, but the application can be difficult, and it took many, many years before I overcame the hurdles that I had encountered. The diameter of the wire, the length of the wire, the position that the solder sat between the tooth and the two wires, the position that Enrico would have his technicians drill the pilot holes, even had an enormous impact on how quickly it was able for me to be able to fit the plate and have it retain adequately enough for us to do what we needed to do with the treatment. The communication aspect of being in email and in phone conversations with Enrico on a regular basis really allowed me to overcome the problems and create predictable timelines that I could book appointments with. When I started training with John, I raised the issue with him about the problems I had with bending wire and getting the shapes of the cat wires and the approximating wires correct. And he said, Simon, it's an art. It can be trained. You do need to practice, but some people just need to find a different discipline to work with. And it really struck a chord within me, because he was basically saying, if you can't bend wire, go home. And it really does come down to that key aspect. Orthodontics is about wires. What I want is to be able to shortcut some of the problems that I had. And I spoke with previous dentists that I trained, and I spoke with John, and I spoke with Mike, and being hands-on, being coached, being supervised is one aspect, but it's very difficult to practice on patients under supervision or not at a university setting. So I found myself on the afternoons that I had off, basically turning up to Enrico's lab and sitting down with him. And, I had him show me how to solder. I had him show me how to bend, a spool of wire into the correct forms to be cat wires, to be clasps. And that helped. That helped immensely. So, the things that work for me can work for anyone, but they don't have to take years and years and years. It can be distilled into an easier digestible form. So we've created a lab day this August 27th, Saturday. Enrico will open up his lab, and for 8 of the dentists who are interested in getting trained on the appliances and working with me to help improve that communication aspect between the dentist and the technician, and get a real sense of what it takes for a technician to create these appliances and understand the limitations they have, and hopefully be able to communicate with me to figure out what are some of the limitations and some of the hurdles clinically on the receiving end of that lab work that you'll have, and how to overcome that. So please consider the opportunity as one that doesn't come around often, and join us at A Point Laboratory on Saturday the 27th of August, and learn what I do on my wire bending, and have a look at what Enrico does for the creation aspect of the appliances that we use in postural orthodontics.